Avoid the single tooth syndrome. It can be easy to get stuck in doing one tooth at a time dentistry. When you do more quadrant and full mouth dentistry, your patients and office both win. The cure to the single tooth syndrome is talk to people about problems areas and comprehensive solutions, not about individual teeth. A problem area is a collection of problems that can be solved with one type of treatment. As an example, posterior teeth that are decayed or fractured, have broken or worn out amalgams, or have faulty PFM crowns are one problem area. This problem area can be solved with onlays and crowns. Discolored, worn and crowded anteriors are another problem area. The problem can be solved with veneers. Generalized periodontal problems can be solved with periotherapy. Lost teeth can be solved with implants, bridges, or partials. In most dental offices, the creation of the single tooth syndrome begins at the patient interview. Most dental teams only discuss individual problems. You do have to discuss specific problems they may be having, but you need to immediately expand the specific problems into problem areas. As an example, if the patient says, "I have a broken metal filling on the upper right," respond with, "I'll make a note of that. Has this ever happened before? And do you have other metal fillings in your mouth like the one that's broken now?" If the patient says yes to either or both questions, the problem is beginning to morph into a problem area. In many dental offices, the single tooth syndrome builds steam during the examination. Most dental professionals only look for individual problems and only talk about individual problems. To cure the syndrome, you must take an extra step. After the exam is done, sit the patient up and say, "Maria, you have 8 large old metal fillings in your mouth. A couple of them are broken, one is decayed, and the rest are worn out. In a few minutes, we'll discuss what we can do to take care of all of them." In most dental offices, the single tooth syndrome climaxes at the treatment conference. The doctor or treatment coordinator goes around the mouth one tooth at a time and tells the patient what needs to be done one tooth at a time. This is time-consuming and confusing. You've got to be different. You must focus on problem areas and comprehensive solutions. Then give the patient several great reasons why single-tooth dentistry is not in their best interest. As an example, "Maria, I mentioned before that you have 5 large metal fillings that are decayed, broken, and just plain worn out. The best way to restore these 5 teeth is with crowns. We can do these 5 crowns one at a time. The problem with that is it takes 2 visits to do each one. That means you'll be coming in 10 times. You'll have to take off work 10 times. We'll have to numb your mouth 10 times. Plus, it's very difficult to make the color and shape of the crowns match if we do them one at a time. It's much better to do them all at once. That way we can do them in 2 or 3 visits. We can start next week and be all done in 3 weeks.